the first symptoms that I noticed physically were headaches, and they got worse and worse and worse, and they would be completely debilitating for 4 or 5 days. And for a long time I didn't know what was causing them. And quickly following the headaches, I noticed a severe brain fog, where I literally wouldn't remember the name of people I was talking to, or why I'd gone into the kitchen to pick something up. So very severe. And until the program, I didn't realize quite how much the more emotional, mental aspects of my symptoms were. And I realized those have been going on for longer. For instance, social anxiety. I'm an extrovert and I'm a performer, but I would get these absolutely frozen moments of social anxiety, for instance. That's been going on for a while, and I recognize that now, having done this 5 days, as very much a part of my limbic system disorder. I've done a lot of therapy, I've done a lot of emotional work and spiritual growth and a lot of self-improvement in an attempt to get around the debilitating, what I would always have called just trauma and sort of emotional scarring. I'm now seeing this as really a symptom of limbic dysfunctions. I've been doing a ton of that, and parts of it got better, but the critical issues didn't. And I'm talking like 25 years of really hard work. I could never understand why I couldn't just, I knew everything and I couldn't make that shift. But in terms of the physical symptoms, when they began, I went to see all MDs. I went back to England, where we have treatment on the National Health. I went to see the top immunology professors, 2 of them supposedly the top in the country. And I traveled all over the United States visiting herbalists and detox people. I've done, I don't know, I can't remember how many detox protocols I've done. And none of them really made a difference. And I'll say this, but just recently I did find one that really did help. It was deep and profound, and it's pretty out there. So my health has improved, but most of what I tried didn't make any difference. I actually spoke to the most eminent the teaching professor at Guy's Hospital in London. When I described my symptoms of MCS, he was very sympathetic, and we talked. He wanted to know all about it, and he made all sorts of comparisons between me and the soldiers that are coming back from the Gulf War and their Gulf War syndrome. And he said, this is fascinating, but to be really honest, I don't think I can help you other than the avoidance thing. So I remember that very specifically, going, wow. And this is the most qualified guy in England. I spent thousands of hours online reading papers from Harvard professors, teaching doctors. I went to another doctor in England who I found myself sitting in his room as he was examining me, telling him what was going on. Like, I was trying to do it politely, but I found myself having to inform him. He had, bless him, nice guy, but he had nothing to offer me. And this guy was, 30 years of experience in allergies. And I heard about DNRS through the detox practitioner that I've been working with for 2 or 3 years, and I've seen some improvement, and she was very enthusiastic. She has read Annie's book, I think, and was very supportive and encouraging. And it was just a matter of when I was well enough to travel, because I couldn't fly. I was a mess. And when I heard that the program was going to be in Ojai, which is where I live, I jumped on it as soon as I could with her support. And my friend Jessica, who's done the program, who lives in Ojai. And literally, I spent time with her witnessing the extraordinary level of improvement. I mean, that's the proof of the pudding, coming from, because I know how sick she was, same as I was, and she's now amazing. She's like a firecracker. And I remember thinking that would never be possible in my life again. I remember thinking that I would have to live in a little cabin in the middle of nowhere with no life, and I had a career, with successful music career with a band, and I was performing to thousands of people, and I have such a passion for that. And I didn't think that I could ever do that again. I did come to the course a little skeptical because I've tried so many things. Even though I saw my friend get completely better, I was worried because it's the brain. And in the same way that I'd be worried about going to a hypnotherapist, I realized that part of my limbic system dysfunction was the need to control and make everything safe all the time, become incredibly rigid like that. So I was worried, what are these guys going to do? They're going to get into my head. And I was also, a little bit of the European and the British inside me was like, this is all, is it all going to be really positive thinking and kind of, we're going to be lobotomized so we don't have our feelings? And I didn't want to turn into an automaton. As soon as I got here, I was so relieved to be in a room full of people like me. Because there's no substitute for being in a room full of people. I've read people's experiences online, and I know people who have had similar issues. But to have a room full of people, it was the most incredible experience. And I noticed changes almost immediately. And they were subtle at first, and I would say they were more in terms of my mood, my mental attitude, the shape, my enthusiasm, which went from worry and anxiety to a calmness, And very quickly I realized when the course is so good, and obviously Annie and Candy and Pat have been working on this for a few years, and they've got it to a place where it's really well communicated, it's really simple, they've refined it. And so it was very easy to start ingesting. And the minute I started the exercises, the particular things that they're recommending, I started to notice shifts in my mental attitude. And one of them, physical symptoms aside, which were completely debilitating for me, I couldn't go anywhere. I would smell a parked car from 200 feet away, and I couldn't walk down that road, even if the engine wasn't running. But the emotional, the negativity, the whirling of my outlook on life, I'm realizing how much of it was limbic. And for instance, social anxiety, being amongst a group, that significantly within the second day, I noticed began to evaporate, and I would start feeling awkward, but it was no longer catastrophic to feel awkward. It just was, my responses became different. And that's a miracle to me. And that was just enough for me to know with 100% certainty that even at this stage, day 5, I've just done the course, I'm a relative stranger to this, I'm 100% certain that this works. I know that if I practice for the next 6 months or beyond, not only is my life going to get better, I know that it's going to be better than it ever has been. I can just feel, it's difficult to describe, I can just feel the potential. What I would say to people is, I want to kind of just, it's a no-brainer. It is absolutely a no-brainer. If anybody has any kind of allergy, multiple chemical sensitivity, any kind of exhaustion, any pain, fibromyalgia, and all the other list of symptoms which you can see on the website, post-traumatic stress disorder, that's a big deal for me. And I know that I'm going to recommend a lot of people that I know with that kind of circumstance to this course, because a lot of the emotional anxiety they're experiencing, and they've been in therapy for 10 years, and they know all about it, but it's still getting them. Oh my goodness. I absolutely, just guys, do this. Come and do this, and then see what happens. Just invest in your life, invest in your wellness, and then see what happens.